Welcome to Techstination. Joining us is Ryan Kraudel, Vice President at Valencell. Thank you for joining us, Ryan.
Thanks, Fred. Glad to be here.
Valencell is a really interesting company doing a lot of work behind the scenes, and I'm going to let you give us a little bit more of a description of what you do.
Great. Yeah. So Valencell makes biometric sensor technology that goes into wearable devices of all kinds. So the easy way to think about our technology is the green blinking lights on the back of a smartwatch or a fitness band that measures heart rate and heart rate variability and cardiac efficiency and other biometrics along those lines. That is very likely Valencell technology. And we put that technology into our customers' devices, our customers being the device makers, those types of devices of all kinds. So everything from smartwatches and fitness bands to audio earbuds and hearing aids and patches and helmets and a pretty broad range of different devices. You know, most people think of wearables as smartwatches, but there's a pretty broad range of different form factors and use cases for this technology.
And that technology really is a big reason why a lot of consumers are interested in those wearables.
Yes, indeed. We're finally getting to a point with wearables where they can provide truly actionable information and biofeedback from the daily activities that anyone is doing while they're wearing those devices, and that feedback is allowing people to ultimately live longer, healthier lives. And the really exciting part is we are really just at the beginning of this process of really providing people actionable information that they can then take to improve their overall health and wellness and fitness levels.
And now you're focusing on another health issue, which is hypertension, and trying to help us, I guess, monitor that without the typical blood pressure cuffs. Tell me about this.
Yeah, so this is something we've been working on for several years now, and something we are really excited about, mainly because hypertension is such a massive global health problem. There's over 1 billion people in the world that have high blood pressure, and the scary part is about half of those people don't even know they have it, and so that leads to all kinds of secondary disease states and issues like stroke and heart failure and coronary heart disease, diabetes. There's a pretty broad range of comorbidities associated with hypertension. And what we have been working on is using this same sensor technology that we put into consumer wearable devices. We now have the ability to measure blood pressure with that same sensor technology in, let's say, an earbud or a hearing aid, to be able to measure blood pressure passively in the background while a person is, let's say, listening to music or a radio interview like this, or watching a show, whatever it might be. We now are in the process of commercializing that technology to make it available to the device makers in the same way that I described earlier, where we provide this core sensor technology to the device makers. And we now have evaluation kits available for those device makers to start evaluating the technology and start building it into their product roadmaps going forward.
So we'll be seeing this relatively soon, it sounds like.
We certainly hope so. There are things that are out of our control in terms of when the technology actually gets to market. So a lot of this depends on our customers, the device makers' product development cycles. It also there also can be a regulatory element to this, depending on the claims that the device is making that could require FDA or CE clearance, and that of course adds time to the go-to-market process for those devices as well. But we hope to see this technology in the marketplace either in late 2020 or 2021.
Interesting. And this is strictly in-ear technology? It's not a wearable on the wrist or something like that, then?
Well, so the state of the technology today is such that we have it working at the ear and also at the fingertip, either or. It doesn't have to be in both places, just either the fingertip or the ear. The ear happens to be one of the best places on the body to measure biometrics with this technology, and so that's where we have focused our research efforts and the development efforts around this technology. And we're also doing data collection efforts around the wrist and other body locations, just given the fact that people like to wear things on their wrist. It just happens to be a much harder place physiologically to measure biometrics with this technology. And so to get something as advanced as a blood pressure reading off of the wrist is extremely challenging with this technology, but it's certainly something that we see happening in the future. It's just a longer roadmap to get there.
With what you have today, how accurate are the readings in comparison to the traditional blood pressure taking methods?
Yeah, great question. And we have tested this technology on thousands of patients, north of 5,000 patients actually, and more than 15,000 data sets from those patients. And most recently, we have undergone the effort of doing a clinical study, a data collection effort according to the ISO standards for accuracy compared to a blood pressure cuff, both the manual method of blood pressure readings with a cuff and then also automated cuffs as well. And what we have found with that research study, and we hope to be publishing the results of that study in Q1 of 2020, we have found that we meet the ISO standard for accuracy of a blood pressure cuff. So what the way I like to summarize it is what we're seeing is cuff-like performance without a blood pressure cuff.
Interesting. So I guess it's up to the device makers here to determine how they're going to employ this, whether or not people would receive alerts of some sort if they're wearing this and their blood pressure is high. I guess it's not taking a constant reading, right? This has to be an intentional.
It is not. This is these are taking point in time. The technology is taking point in time readings. What is interesting though is the ability of sensor technology like this to take blood pressure readings, as I mentioned, passively, sort of in the background, and get more of a longitudinal view of an individual's blood pressure as they go about their daily activities. You know, today most people get their blood pressure taken either when they're at the doctor's office or if they're pre-hypertensive or have hypertension, they're taking blood pressure measurements with a cuff, most likely a few times a day. But if you can get more of a granular view, more readings throughout the day as someone goes about their daily activities, you're going to start to see different trends and different indicators that increase an individual's blood pressure as well as decrease an individual's blood pressure, and again provide guidance around, or at least potential for guidance around, encouraging things that reduce blood pressure and discouraging things that increase blood pressure.
Interesting. And this can also be used in hearing aids besides the traditional earbuds for music or other things?
Yeah, so we're right now in the process of developing sensor technology that goes into the receiver in canal of a hearing aid, the part that goes actually in the ear canal. And as those platforms get established, we then see a clear path to be able to add this blood pressure technology to those heart rate sensors that we're adding into the hearing aids going forward.
Well, congratulations on the work that you're doing there. Where can people go to learn more about it?
So and thanks, Fred. I've really enjoyed the conversation and appreciate the time. People can go to valencell.com, which is VALENCELL.com. And we've got a dedicated portion of our website that's just valencell.com/blood pressure. And you can find out a lot more about it right there.
Again, it's valencell.com/blood pressure. Ryan Kraudel, thank you for taking the time with us.
Thanks, Fred. I appreciate it.
Cooking with the power of the sun. Hi, I'm Fred Fishkin, here to tell you about the latest innovation from my friend Patrick Sherwin and his great team at GoSun Stove. The GoSun Fusion has arrived using the company's tried and true reflectors and a solar vacuum tube to get you cooking without the mess of charcoal, heavy propane tanks, or smoke. A really bright idea. And with an optional solar panel and battery storage and the ability to plug in at home or on the road, you really can use the GoSun Fusion to cook anytime and anywhere, day or night, rain or shine. I love what Patrick and his team are doing, and so will you. Want to learn more? Head to gosun.co to check out all of the company's products and innovations and use the code Techstination to save 10%. That's gosun.co.